everything and so that everyone, including everyone in the back, can hear. Since we're live streaming, we are going to get started in just a minute. So we have, how many? We have like 2 or 3 more minutes. 4 minutes.
Yep.
Before we get started. So this is your time to put everything away and get ready for the presentation.
Why don't you talk about junior achievement a little bit and what we do?
Yeah, okay, I was going to wait till 10, but that works too. So who here has heard about junior achievement before? Raise your hand. Okay, I see like 1 hand. So Junior Achievement, for those of you who don't know, we are a nonprofit organization and we partner with schools to provide the opportunity for you all to learn about financial literacy, work readiness, and entrepreneurship, right? So I always try to say that it's things I wish I would have learned growing up. So raise your hand if you know any entrepreneurs. Anyone who started a business, a company, right? Raise your hand if you've seen Shark Tank. That show, yeah. So we work to provide information to all students in Palm Beach County so that you all can have information about what it's like to be an entrepreneur and so that you can understand what it takes to get there if that's the path you want to go. Right, today we're going to be talking about work readiness. We are going to be talking to you all about jobs in the medical field. So is everyone here, by a show of hands, raise your hand if you're in the medical field. Right, you want to go into the medical academy, you want to go into the medical field. Keep your hand raised if you know exactly what you want to do in the medical field. I saw a lot of hands drop. Right, so one of the reasons we're here is to show you all the different opportunities that are actually in the healthcare field, because when I grew up, I understood that there were doctors and nurses, and that was pretty much all I knew in the medical field, right? But there's such a wide range of jobs. So we're here to bring in people from the healthcare community to truly talk about what's out there, because they pretty much have everything except a pilot, right? So you could be HR, you could be IT for a hospital, there's so many things. So today we're excited to introduce Stephanie Welch so that all of you can understand what she does in the medical field.
Let's go ahead and get started.
All right, so we're gonna go ahead and get started. Some of this might be repeated just a little bit. All right, so good morning, everyone.
Good morning.
All right, I'm gonna try that one more time. It's Friday. Good morning, everyone.
Good morning.
Thank you. All right, so good morning. My name is Lauren Henderson. I am the Director of Secondary Programs with Junior Achievement of the Palm Beaches and Treasure Coast. And we're super excited to be here today to introduce all of you to job opportunities in the healthcare field. So for those of you who don't know, again, Junior Achievement is a nonprofit organization, and we partner with schools to provide students the opportunity to learn about financial literacy, work readiness, and entrepreneurship. And today we have the Invest in Your Health Career Speaker Series, where we bring healthcare professionals that are out there currently to come into the classroom to speak to all of you, to show what they do and talk about their career journey, so that you can hear about all the different opportunities that are out there. We'd like to quickly thank Kaiser University and Florida Atlantic University for sponsoring this event, and let's give a huge shout out to Park Vista Community High School for hosting us today. Thank you, Park Vista. All right, so we have someone very exciting from Kaiser University who's going to talk about how do you get there, right? I've always wondered, how do I get to where I want to be when I grow up? Now she's going to talk about her experience in the healthcare field and how she brings her passion into her everyday life, into her everyday work, and answer that question for many of you, how do I get there? So let's please give a warm welcome to Stephanie Welch.
Thank you, Lauren. So, I saw a lot of you raise your hands that you already know what you want to do when you grow up. I am envious because I'm still trying to figure that out myself. So I'm going to give you a little background on me and then the journey that has led me to where I am right now and where we plan to go. So, I am a retired Olympic swimmer. I've been to 3 Olympics, went to college on a full athletic scholarship. Little fun fact, I also played the cello and wrote several orchestral pieces. So a little bit of a nerd, but it's paid off in the end. So I went to a private boarding school down here in Florida, down in Fort Lauderdale, and then went to University of Arkansas Medical Sciences, College of Nursing. So my journey started a little differently though, because like some of you, you know what you want to be. I didn't have an idea in the world of what I wanted to be. I tried everything you could imagine. And it was just a fluke that one day a good friend of mine said, hey, you know, my office is looking for a medical secretary. And I was like, oh, I could do that probably. I mean, how hard could that be, right? So I started with general surgery as a medical secretary, meaning answered the phones, made appointments, got charts together, you know, collected copays, basic things. And that office was very small. It was one physician, one MA, an office manager, and myself. So when the MA left, they were looking for somebody, and I said, hey, I think I could handle this. I mean, how hard could it be? And so I transitioned into a medical assistant. Now, I'm very old, so think about it. Back then when I was an MA, we didn't have schools or really training programs. So I was physician trained, which means the doctor that I worked for, the general surgeon, he trained me according to what MAs needed to know in the field. So in that field, I learned how to do surgeries, injections, drawing blood, suturing, suture removal, staples, staple remover, and then went into the OR with him and assisted him with very basic procedures and things like that. From there, he sat me down one day and said, you know, you're kind of wasting your life just being an MA, think about going back to school. And I was like, oh, well, where do you go from here? You know, I had no idea. And so nursing was the next logical step for me. So I finished my prereqs and got into nursing school. Now, nursing school, man, how many of you want to be nurses when you grow up? Godspeed. Good luck. It's quick and fast, and hold on, because it's going to be the journey of your life. So I got into nursing school, and the first semester you're there, just so you know, it's strictly lecture, class, clinicals, studying, no life. But if you can make it through your first semester, you'll make it through your last 3. Trust me, I promise you on that. So during my second semester, I got a job as a critical care assistant, which means I got to work in the hospital with nurses and doctors and practitioners, and you name it, I worked with them. And when I was working there, I did trauma. So I did gunshots, stabbings, you name it, anything that was a trauma level 1, I got to assist with, I got to help with, even got to take a couple journeys on the Trauma Hawk to go out to rural areas to pick up the patient to bring them back to the hospital and keep them alive. Got through nursing school and said, okay, this is what I'm going to do the rest of my life. I'm going to be a trauma nurse. I love it. It's adrenaline. It's awesome. And I graduated, and my boss said, we're on a hiring freeze. Can't hire you. Gotta go. Well, at that point, I was like, where am I going to go? I only wanted to do trauma, right? Well, I did a 3-day working interview in cardiology, and next thing you know, I'm a cardiology heart transplant nurse. So my specialty is cardiology with heart transplantation. So I take your broken hearts, and I make them whole again. So not only do I do that, if your heart is sick, I can help fix it, I can pacemake you, I can put a defibrillator in. So my specialty now is cardiology. From there, got my master's in education, sports administration, and law from University of Miami, because at that point I said, I still don't know what I want to be yet, so let's just try something else, right, to see how it goes. And it was during that time that I was becoming very burnt out being a trauma nurse, being an ICU cardiac nurse, and said, well, what am I good at? Well, I did medical assisting for 10 years. Let's go back to trying that out. Not working as an MA, but applied to Indian River State College as an adjunct to teach medical assisting, and what do you know, I found my niche. I enjoyed it. I got to take a student on their first day and take them from the journey at the beginning all the way through the end and everywhere in between. And I enjoyed watching these students learn. And then when they mastered a skill, like the light bulb went on, I was like, oh, I can do this. Yes, you can. It's not as hard as you think it is. And from there, went in and decided, well, might as well just get one more degree while we're at it, right? Let's be that professional student, okay? We're no longer a professional student, we graduated, but received a dual doctorate. So I have an EDD in education with a concentration in adult education, with the main focus being organizational leadership. So at that time, Kaiser University was hiring, and it's kind of a sad story because I went for an interview, and the dean was like, we'll know by Monday. We have one other person that we're interviewing on Friday. We'll let you know Monday. Monday came around, sure enough, I didn't get the job. So not a big deal. I was still working in my field, doing what I liked doing, which was teaching, and started teaching in a different area of the field, teaching CPR, so basic life support, advanced cardiac life support, and things like that. Within 8 months, got an email from the dean asking me, hey, what are you doing with your life? You still teaching? Well, yes, I am. So went down, I thought it was for a full-time teaching position, and it turned out it was to be the program director. So I have been with Kaiser for 5.5 years as the medical assisting program director. In that time, I have become the medical billing and coding program director, so I actually oversee on-ground programs, online programs, and English and Spanish. During my time at Kaiser, I also became what was called the University Department Chair, so I oversaw 18 campuses, 9 programs. So I had quite a few program directors reporting to me. We were changing curriculum, updating curriculum. I was venturing out to all the different campuses that we have, all the way from South Florida, all the way up to North Florida, and on the other coast. My current role now, because my UDC position is over, so now I just strictly focus on medical assisting and billing and coding. So what I do in the MA program is I am what's called a one-man band. So I teach from the very first class to your very last class. So I'm with you your entire journey. So I am the only instructor plus the program director. I've had 109 students go through the program, graduate. 11 of them graduated Phi Theta Kappa Honor Society. All of them have jobs in their field. Every one of them will pass the licensure exam, so they're all licensed, which means they are very well utilized. In that time, I have developed curriculum. So I have developed a phlebotomy curriculum, IV curriculum, EKG curriculum. So if you're not sure if the medical field is for you yet, and you can't make a full-time commitment, you can take one of the certification classes and see, can I handle this? Can I handle blood? Can I handle skin? You know, can I handle putting a needle into somebody's vein? What if I pass out and they don't? Well, it's okay, you'll be fine, right? They'll just step over you as they're leaving. So we offer that as a gateway into the programs. In my current field, I teach in quite a few of our other programs. So I teach in the nursing field. I am the one that teaches your cardiology system along with your EKG system. I teach in the radiologic technology program, which is your x-ray techs. I teach them their vitals, IV starts, and phlebotomy. And right now my program is currently paired with the College of Chiropractor that we have, and we are doing a clinical trial. So my team, what my students are doing are the blood draws. Okay, so they're drawing the blood, spinning them down, and then they're pouring them off and or freezing them and then getting them ready for transport by the labs. So I do a little bit of everything at Kaiser, not just one hat. The current track that I'm in right now is to become an associate dean. That's where I would like to be, associate dean of Allied Health. So that means that all of the medical programs, occupational therapy, physical therapy, radiology, ASN, BSN, my program itself, MA, and College of Chiropractor would report to me. We do, check-ins, how's it going? What do we need to do? What do we need to change? Are we giving you the support that you guys need to further the education? Now, those of you that raised your hand that you are in a medical program, how many of you have ever thought about being a medical assistant or you want to be a medical assistant? Of course not. You all want to be nurses, right? How many of you want to be a nurse? Medical assistant? Physical therapist, occupational therapist, radiologic technologist, which means doing x-rays. How many of you just want to be in the medical field, you're not sure yet where you want to do? That's where I was too. It's not a bad place to be. So if you enter into my program, here's what's great about my program. Medical assisting is not just medical assisting. It opens up several gateways and pathways into other career fields when you graduate. So when you complete my 18th-month program, you graduate with your Associate of Science in Medical Assisting degree, okay? So at that time, you have so many doors open to you. I have several that have gone further and gone into nursing school. In fact, 3 of them are graduating this semester with honors. I have several that have gone into the surgical technology program because they want to work in the OR next to that surgeon and want to be hands-on in the cavity chest like I was. I've got several that went into ultrasound sonography, which means they are doing all the ultrasounds for the pregnant mamas because they love babies. I've had some that have gone into billing and coding and some that have gone into completely different fields that have nothing to do with medical. It was just their gateway to get their foot into the door. So they've gone into hospital IT, or they've gone into like the chief operating roles in the hospital. So my program is a basic foundation program. What I do, my goal is to set your foundation so it's solid. So once you decide you're going to go further in your education, which you all should, wherever you end up, when they're putting those 4 walls and that roof on your foundation, it's going to be solid. It's not going to crumble, it's not going to crack, and you're going to do very well. what worked for me was being an MA for 10 years before going into nursing school. It made it easier because I had worked in the field. So I knew medical terminology, I knew procedures, I knew a lot of skills, I knew how to speak to the physicians and other practitioners. And so for me, nursing school was very easy because I'd already had 10 years. What I wasn't prepared for was being a nurse. It's very different, you know. I was used to trauma and then switching roles into cardiac heart transplants. How many of you watch Grey's Anatomy? Of course. And how many of you sit there and you watch when they do like open chest procedures and you're like, oh, that is so cool? Just so you know, that's not real. Just so you know, okay? My first procedure where they actually sawed the chest open and started to pull it apart, I was like, oh my God, what happened? And I laid on the floor for the whole procedure. It wasn't until the second or third one I was able to tolerate the sounds, the smells, and the actual sight of what I was being introduced to, okay? So Grey's Anatomy, you guys, it's all fictional. It does not prepare you, just so you know. But I enjoyed doing heart transplants. During that time, I did some organ recovery, which means I may wake up in one state that morning, scrub in, get my organs that I need, and by the end of the day, I'm flying to a completely different state to put those organs into another human being so they have a chance at life. So I've done a lot, I've seen a lot. I had some pictures, but I took them out of the slide. I didn't know how many of you guys would enjoy seeing like open chests and hearts and blood and stuff, so you're getting a very boring PowerPoint presentation, I'm sorry, okay? I toned it down. Now, if you come to Kaiser, I can show you the real one and you could be like, oh my God, that's awesome, okay? And you do learn some of that in my program, and then of course, you know, we further that in the nursing fields or whatever field you go into. So I'm gonna talk a little bit about medical assisting. Hopefully maybe that sways some of you to decide to become a medical assistant first. Or let's say you're trying to get into nursing and you're not making the TEAS score. The TEAS is math, science, and English, okay? It's a test that we use to see can you be a nurse, because nursing is math, science, and English. And you're thinking, how can it be English? Well, don't you have to talk to family members? Don't you have to communicate with physicians? Don't you have to chart? That's knowing your English, right? And then your math. Well, you have to know math, not only for nursing, you have to know it in my program because you calculate drug dosages so that you make sure that your patient's getting the right amount of the drug and you're not just deciding to put them in a permanent sleep state. And then science. Well, isn't science what medicine is? Science is all medicine. So you take that exam, let's say you don't make the score. Doesn't mean you have to be discouraged. Guess what? My program has a specific track in it from MA to the BSN program, which means we prepare you for the nursing program, and several of my graduates went that route. They became an MA first, worked in the field for about 3 to 5 years, and then slid into the nursing route. So I'm gonna talk about that for some of you that aren't sure, you know, nursing, MA, or what you wanna do. So you can see I'm the Associate of Science Medical Assisting Program Director. So ASMA, the difference is this one is an on-ground program. We have Associates of Science and Medical Assisting Science, ASMAS, that is online. Then we have it in the Spanish version also for our Spanish-speaking students. Then we have billing and coding and stuff. So medical assistants, what do? Well, they work alongside physicians, mainly in outpatient or ambulatory settings. Okay, so they work in clinics, outpatient settings. They're in demand. It's one of the fastest, it's one of the fastest growing fields. In fact, it's gone up by 37% within the last year. In fact, I have more demand than I have supply. So I get more calls every day from doctors begging for my students, and I'm like, I'm sorry, I just don't have enough to give to you. The predicted surge in the number of physicians' offices and outpatient care facilities is growing. Why? Baby boomers are becoming of age. We've got technological advancements and a growing number of elderly Americans who need medical treatment. So, how many of you have ever thought about taking care of the elderly population? You'd be a geriatrician. So, just so you guys know, if you've ever thought about that or thought about becoming an MA that specializes in geriatrics, how many of you like money? Right? We all like money. Just an FYI, you'll never get rich in the medical field, but it's a nice alert. To be a geriatric MA, $10,000 sign-on bonus, because nobody wants to work with older adults, right? So To be an MA, geriatric MA, it's a $10,000 sign-on bonus, and guess what most of you guys would be starting at per hour? $20 to $23 an hour. That's not bad. When I was an MA, I made $10 an hour and thought, my God, I am so rich, I'm gonna retire soon. Yeah, I'm still working, as you can see. So nowadays, it's doubled to almost tripled, and it's also doubled and tripled depending upon your specialty. So what are some of the duties? Well, there's two separate parts that make up an MA, clinical and administrative. Clinical, you work in the back, you're hands-on, you're side by side with the physician. Your administrative, you're working up front. So the administrative checks the patient in, updates their insurances, verifies insurances, collects co-pays, talks about their coding, right? So it talks about their billing and coding fees, things like that, explains their explanation of benefits to them, makes appointments, does admissions and things. Your clinical MAs, those are your hands-on MAs. You are with that physician from start to finish and everywhere in between. And I always say the medical assistant is really the boss of the office and everything, because if it wasn't for you guys, you think your physician would know what they're doing, who they're seeing, and what room they're going in to be able to do. So you guys really run the office, your boss just happens to sign your paycheck and everything, and that's really the truth, because you guys are the backbones of offices. You keep them running like they need to be run. So you'll do medical histories, so the patient will come in, you'll ask them what brings you in today, you'll update their chart, everything like that. You're going to explain the treatment procedures. One of the biggest jobs of an MA is education, education, education. Why you're doing it, how it's going to be done, and how it works. How many of you have ever gone to the doctor and they say, oh, just take this antibiotic for 7 days and you'll be fine? Don't you think you have more questions than just take your antibiotic for 7 days and you'll be fine? There's a lot of science that goes in behind that. Well, you say take it twice a day. When should I be taking it twice a day? Well, there are set times. Do I take it with food, without food? What happens if I don't take it with food? What should I expect as a side effect versus an adverse reaction? So MAs do a lot of education and explaining. Collect and prepare lab specimens. How many of you are squeamish, meaning you don't like blood or bodily fluids? Don't go into the medical field then if you don't like that. So you're going to be doing that. At some points in times, you're going to be assisting that physician with in-office procedures, which means you're going to be helping to cut that patient open and be removing parts that should not be there or that are bothersome to the patient. You're going to perform basic tests. You might have to do blood sugar testing, A1C testing, cholesterol checks, drawing labs, sputums, things like that. Instruct the patient, how do we take our medicines and what diet should we go along with that? So me being a cardiac heart transplant nurse, the number one diet that I always tell my patients you gotta follow is a cardiac diet. Low salt, low cholesterol, right? Diet, exercise, which means your food's going to be very bland and boring and you're gonna hate it, but it's gonna keep you alive, so you're welcome. Preparing and administering medications, that's one of the biggest jobs that you guys are gonna do. You're gonna give a lot of injections, you're gonna give a lot of medications. That's where your science comes in and that's where your math comes in. You don't want to give your patient too much, but you also don't want to give them too little. Then you transmit prescriptions. So the patient calls and says, I'm out of my medication. You get to send it to this pharmacy form. Now, you don't just open and send a refill. Have they been in within the last 6 months or a year? Okay, great, they have. We can refill it. If it's been longer for a year, we need to see the patient first to make sure there are no changes that need to be made. Phlebotomy, which is blood drawing, electrocardiograms, and a lot of wound care and dressing changes. So depending on the field you worked in, when I started off in general surgery, I had a lot of wound care dressings and changes. Why? Because the surgeon that I worked for was a specialist in mastectomies and breast cancers, and then he did every other part of general surgery. So we did a lot of dressing changes and things like that. So you're going to act as a patient liaison. What does that mean? Well, you're going to be that point of contact for your patient. You're going to be their navigator. You're going to make sure that your patient is getting everything that they need in the office and out of the office. And you're thinking, well, how can I help them out of the office? Well, some of your patients that you're going to see live on a very fixed income, right? Which means they have just enough money to pay their little bills and maybe afford their medications. But if it came down to paying the electric bill or refilling their medications, how many of you think they're going to pay the electric bill and skip their meds? Mostly all your patients would pay the electric bill and skip their medications. Your job as an MA is to find the resources out there that are available. How many of you know that your big pharma companies, and I was told you had pharma come and talk to you yesterday, How many of you know that your big pharma companies offer patient assistance programs? What that means is if your patient meets a certain criteria, they can get their medications for free or as low as $5 for an entire year. So you're gonna do things like that. Your little elderly patients, right? Again, they're on a very fixed income. Well, they don't eat the best foods when they retire and they get on a fixed income, so you're gonna learn about Meals on Wheels. So it's knowing what do you need to provide for your patients so they can be compliant, which means take their medications like they should, and that they can live like they need to. You're also gonna be a member of your team. So medical assistants are essential members of the patient-centered medical home team. So what that means is, look at that, you're ranked as one of the top 5 professionals necessary for that team to survive. You're the one that's checking in with your patients, how's it going? Do you need anything? Do you need me to come out to the house and do an evaluation on you? What's going on? You're the ones checking in. You're that frontline provider for your patient. This is that MA to RN pathway. So for some of you that want to be a nurse, but you're not ready yet to be a nurse, keyword ready yet to be a nurse, you can come into the MA program. Now here's what's great. MA students with a long-term goal of becoming an RN can simply and possibly shorten the path by completing an MA program with transferable courses. So what that means is, not only does your work history count towards the nursing program, a lot of the courses you take as an MA are a lot of the courses you would take as a nurse, except of course we know the nursing courses are just more expanded and longer, okay? So you can get into one. Kaiser, my campus, which is the West Palm Beach campus, actually happens to offer that. Like I said, I've got 3 graduating this year in the nursing program and 2 that will be going into their last semester in about 3 months. So if you're not sure if you want to be a nurse yet, or you know you're not ready to be a nurse yet, but you want to be in that medical field, guys, there are a lot of opportunities available to you, and medical assisting is one of them. So some of the career pathways after getting their ASMA is they become a certified biller and coder. Office managers. So a lot of them after this go into what's called the Health Service Administration program. It's a bachelor's degree. They learn how to run an office. So they learn not only the HR aspect, but they learn the budget aspect of it also. Because it's not just showing up and talking to your employees and things like that. You also have to pay the bills for the doc. BSN to RN, and then medical sonography, of course, and those are just a few. Like I said, this is a pathway that is open to a lot of doors once you graduate. Always available to meet with prospective students. If any of you ever wanted to come and shadow the program, you guys are more than welcome to actually see what we do. We do live hands-on skills. We use no simulation in my program, which means we use no mannequins or robots. Each of you would be a live specimen. So we draw blood on each other, we collect each other's urines, we test urines, we do strep throat testing on each other, COVID testing. The only thing that we don't do on each other are injections and IV starts. We use a mannequin for that. And we don't give medications to each other, but we simulate it. So one of the ways I simulate it in my program is when we do injections, we bring a hot dog and a grapefruit that day. You're gonna think hot dog and a grapefruit? Are we having a cookout? No, we're not. The hot dog we use to simulate intradermal injections, and if you do it properly, it makes a really nice wheel on that hot dog, and it looks just as if you were giving a real intradermal injection to your patient. The grapefruit is used when we do intramuscular and subcutaneous, because if you went into the appropriate angles when you're doing your injections, when we cut it open, you'll see the color changes of the medications that you injected. So those are ones we can't do on each other, but we practice that way. But everything else in this program is all live on each other. We don't use any simulations whatsoever. Any questions?
Your most memorable case that you did, either as a trauma nurse or as a transplant nurse, what was the most memorable case you had?
Most memorable case.
Most memorable. Well, there was 2. There was the one where I got to first scrub in and assist and was passed out on the floor. You'll never forget that one. And then it was a young kid who was involved in a gang war. He was shot directly into the heart, and we had to get him in. So the level 1 trauma hospital I worked at, you were either brought in one of 2 ways, via ambulance or a trauma hawk. Well, if you are a absolute critical patient and you're brought in by trauma hawk, how many of you know that the trauma hawk doesn't touch down and land on the landing pad? They drop the patient to you because it takes too much time to drop the trauma hawk down and turn it off for us to be able to get that patient out. So one of my most memorable ones is, one, I didn't even know that the trauma hawk could do that. I thought they had to land and we had to go out and get the patient. No, they literally drop the patient to you. And then we take him into the OR elevator, and when we cracked him open, believe it or not, the bullet missed his main ventricle. So he was very savable. A lot of them that came to us were not savable. He was savable. We worked for 29 and a half hours. We removed the bullet. We did all the repairs we needed to. We had to reattach some things. And at one point, to give his heart a rest, how many of you have ever heard the term ECMO? So we put him to ECMO, which means this machine acted as his heart. So we put these large tubes in through his heart, we turned it on, and this machine for 20 of those 29 hours was his actual heart. It pumped, it circulated, and kept him alive until we could reestablish blood flow, we could get the bleeding under control, we could get the damage under control, and he went on to live a very long life. They actually, after that, decided, I think I should probably get out of the gang life. It's not for me. I nearly died. And so he is doing very well. He graduated high school, and he has gone on to medical school. Generally, that's how it happens. You're gonna ask, well, how do you know that? So a lot of my patients, the young ones, have stayed in touch with me. They keep up with me, they tell me what's going on. For example, this morning, one of my graduates, she graduated 6 years ago, texted me and said, Dr. Welch, I need some help, I need your opinion. What do I do now? What's my next step? So I happen to know that one. What was shocking is how he was shot. He should not have survived. So that's one of my most memorable ones. A couple of my other ones now, so I know a lot of you probably want to do pediatrics. How many of you want to do labor delivering pediatrics? You want to hold babies. That was not my strong suit, just so you know. So how many of you guys know now, within the last 2 years, we've developed a new procedure that if the baby's heart is developing either outside of their chest as they are developing in utero, which means inside the mother, and or they have a hole in their ventricle, or they have an undeveloped valve, we now go in, we remove that fetus from the mother, we keep them intact in the amnio sac though, we put the baby on the OR table, we repair it all robotically, and then just put him right back into mom, sew her back up, and she continues on having a normal pregnancy. How many of you are aware of that? So that's been within the last 2 years. There's been 9 cases, and all 9 of those fetuses have developed normal and have been born with no further complications or problems. So it's not all about glitz and glam and good stuff. Sometimes, yeah, I've had a lot of patients die on me. One of the biggest things you have to learn how to do is disconnect yourself, okay? If you don't learn how to disconnect yourself, you're gonna burn out very fast. And what I mean by disconnect yourself is you still go in, you give it 110% every single day, you're very empathetic, you do what you need to do, but if and when your patient passes away, you don't take that with you. So there is a belief in the nursing world, and a lot of you will be introduced to this. I still do it when I do hospice care for patients and things like that. So when a patient passes away, the first thing you do is you open the window. Why do you open a window? Do any of you guys know why you should open a window immediately?
For the air?
That's so their souls can fly to heaven and not be trapped where they are. And if you don't believe that, it is real. So one of my third cases as being a nurse and everything, I had no idea that that was a thing. I didn't know that you did that. So I'm getting my patient ready, I'm getting him cleaned up, I'm putting him in the body bag for him to be transported to the morgue, and the window flew open. I had no idea. One of the nurses came in and said, "Did you not open that window when your patient passed away?" I said, "No." I said, "Why would I do that?" I said, "It's snowing outside, I don't want to freeze to death." And that's when I was introduced to, you always open the window when your patient passes away so that their soul can go to heaven and leave where they are. So those of you that know that, when you become nurses, techs, docs, whatever you want to become, make sure that you do that. It also gives the family a little bit of comfort. Because remember, you're not just there for your patient, you're there for for the family also, right? Because it's not just your patient experiencing this, it's the family that's involved with it. And you're going to learn to cry with that family, you're going to learn to be strong for that family, just like you're going to cry with that patient, and you're going to be very strong for that patient when you need to, right? So where do you learn that? Well, you would learn that in medical assisting and then all the way up through nursing. What other questions do you have? Go ahead. In the gray sweater.
Okay. You said you were physician trained. Do you need to have a degree for that?
So, you actually don't. Like I said, when I became an MA, schools were not a thing. So you didn't know to go to school and get into a medical assisting program. And there are actually 2 tracks of medical assisting, and I believe in both of them. There's my track, which you graduate with a 2-year college degree and associate's degree. You can go to Palm Beach State College, Indian River State College, and you graduate with what's called a medical assisting diploma. So no, you don't need a degree to be an MA. I didn't know that there was such a thing at the time, so I was grandfathered into the licensure boards, which means I was able to show that I'd been in the field, I was trained properly, I could do certain necessary skills, and I got my license that way. Now most of you will go to school, whether it's a college, a university or a college. You may get a vocational degree or you may get a college degree. The difference is a college degree, when you get your associates and you decide I want to go further in my educational career, those general education courses, so like math, English, speech, computers, sciences, psychology, they all transfer into the next educational track you want to go to. If you get a diploma in medical assisting, there's no general education courses, it's just medical assisting. So if you said one day, I'm ready to be a nurse now, you'd be starting as a brand new student basically. So you'd have to start in the general education track to go into the nursing track. So that's what is kind of different. A lot of physicians now don't physician train because there's so much work involved in it and it's such a tedious task. Like when he would do things, he had to show me, he had to explain it to me, and then he would quiz me on it so that I could, not only could I reproduce it, but I would understand the reasonings behind it. Does that kind of answer your question?
How are your shifts like when you're in the hospital?
When you're an RN1 or a brand new nurse, guess what? You get the crappiest shifts ever. You don't get to pick and choose. So I liked working night shift. Why? All administration went home and we could relax. I'm not gonna lie, we had fun. We would do wheelchair races down the hallway. Sometimes we'd race our patient's bed down the hallway. I'm not saying that you're supposed to be doing that, but it was more relaxed. As you become a more seasoned nurse, which means RN 2, 3, and 4, you get to start picking your shifts. When do you want to work versus when don't you want to work? What holidays do you want to work? What holidays don't you want to work? So when I first started off, I didn't get to pick any of that. I was told, here are your 12s, here's how you're going to work, here are your holidays, and just deal with it. Once I became an RN 2 and 3, I got to be more selective. So I said, this is when I want to work. I want to have this holiday. I don't want that holiday. And I want to work night shift. I don't want to work day shift. And they are 12 hours. But I will be honest, in the field that I was in, yes, it's a 12-hour shift, okay? Which means you clock in at 7 p.m., technically you clock out at 7 a.m. Well, if you're doing heart transplants, do you think your patient follows that schedule of, okay, I'll be good for 12 hours? There were times where a 12-hour ran into a 14 to a 16, almost to a 24-hour, because your job is to keep that patient alive and they're critical. If it's a fresh, what we call a fresh heart and lung transplant, which means they had to have a heart transplant with a lung transplant, you're there for 24 hours because you're with that patient for pre-op, intra-op, post-op, and care. Until they're stable enough, you can have another nurse come in and take over your shift. So in the beginning, you get all the bad shifts. You don't get to pick and choose. And as far as being an RN1, you don't really have a life yet as an RN1 because they may stick you on all the weekend shifts or all during the weekday shifts and you're just like, I'd like to take a nap now, I'm tired, and it's time to get back up and do it all over again. Next question, go ahead.
Once you're licensed, how often do you have to get it renewed?
Every 5 years. So for medical assisting, it's every 3. For my nursing, it's every 5. So what's nice is keeping both licenses active. A lot of the continuing education units I use to keep my 2 MA licenses active. I can flip those over to my nursing one. So I kind of cheat and everything, which is totally legal. It's not illegal, by the way, but there are some that are 8 years. It depends on what licensure field you're going into. Next question.
Since there's like a select amount of people that go into like that MA program, like what do you look for like in applicants or like what stands out to you like the most?
So I look for the desire and the drive. Grades, how many of you like high school? You're lucky. You can be honest, I hated high school. I did just enough to make it through high school. It wasn't until I went to college where I found out that grades and desire play a huge role. When I wanted to be a nurse, man, my grades were like A's and B's. When I wanted to get my next degree, my grades were A's and B's. So I look for what is your drive, what is your passion, what is your desire, but my biggest thing that I always ask on your first interview is, what do you want to do in 5 years? What track are you looking at in 5 years? And what's good about my program that I oversee is I can actually manipulate it. So if you said, I for sure want to be a nurse when I graduate, I can manipulate your general education courses. So I can still make sure that you meet the gen eds required to get my degree, but you also do the gen eds required to get your nursing degree. So it's a shorter amount of time that you need to be in school where you can just go into the nursing focus. So it's not necessarily grades, because can't we turn an F into an A or a B? Absolutely. But that only happens once you find the area that you are enthusiastic about and that you are like, this is what I definitely want to be. So when I'm interviewing the students, it's, are they excited? Is this what they really want to do? And are they passionate about it? Like when they talk about it, man, does their whole body like light up? Do they get into the discussion and everything? So not really grades per se. I look more at the commitment and the dedication. Next question.
What's your favorite part about teaching?
Watching the student get a skill that they thought they could never get. So one of my fun skills that I love to teach is sterile gloving. Now, you have to be very sterile, especially if you're going to stick your hands into a body part, right? Because you don't want to introduce a pathogen, which is a disease, right, or a microorganism, into a patient. And everybody thinks, oh, sterile gloving, how hard can that be? That's so easy. It is hilarious to watch these kids not cross-contaminate one glove to the next glove. So it's finally after weeks and weeks of practice, and they're like, hey, Dr. Welch, watch this. And they can stick a pair of gloves on as if they've been doing it for years. So for me, it's the excitement that they show when they finally have grasped the skill, but they understand the didactic or the cognitive behind that skill. So that's what keeps me teaching and everything, is watching them get it. Now, a lot of them have said, why don't you go and just strictly teach in the nursing? Nurses, we're tough. We think we know everything and you can't teach us anything. Whereas medical assistants, they come in, it's a blank slate, and they want you to teach them everything that you can and the amount of time that you have them, and that's all they want to do is learn, 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 do. So I stay in medical assisting because I like to watch them finally grasp and understand what they're doing and why they're doing it. Next question.
What was the hardest part about nursing school?
What was the hardest part? The crying, the silently cussing at my instructors. No, honestly, for me, it was trying not to use what I learned as an MA and bring that into nursing. Because we do things a little differently as a nurse. And some of me was like, I already know how to do that. Why do I got to do this again, right? So for me, it was learning to be humble and finally stop acting like I knew it all and actually learn. Is nursing difficult? Yes. You're going to spend hours upon hours upon hours studying and preparing. Not memorizing, because we're in a medical field, folks. You can't memorize, because guess what? The minute you memorize, guess what's happening? 1 second later, it's completely changed and it's different. But it's learning and understanding. So probably the hardest part for me was learning to just say, I don't know. And being okay with saying, can you show me? You have to understand the nursing school that I went to, is it very large? Yes, but it's in the middle of Arkansas. So my clinicals were not your usual clinicals. I didn't get up in the morning and go to the hospital and do my 12 hours and then go home and write about it. My clinicals were get up at 3 a.m. to be to this airport by 4 a.m. to be on a little crop duster plane to be dropped into the middle of rural Arkansas, which is nowhere, and go to this clinic, start the generator, and see the patients. So the patients I saw were very poor patients. They were basically just farmers with a 6th grade education. And it was learning how to be humble and say, wow, I'm here to serve you. What can I do for you? And at the end of those 15 hours, get back into the car, and you have to understand you're dealing with patients that are poor but so grateful that you're giving your time to them, whereas you should be grateful they're giving their time to you, because that's a learning experience. That I would leave at the end of the day with chickens in a crate, vegetables. They were so happy that's how they paid you. You couldn't say, no, no. You had to take it and say, thank you so much. So imagine being back on this crop duster and you've got chickens and eggs and vegetables everywhere, right? So that was the type of nursing school I went to. I learned a big fancy hospital. I also learned the back end of being humble and what it's like to be poor and deal with that. Next question.
Does Kaiser accept like scholarships or the ACE diploma?
Absolutely. So Kaiser, she asked, do we have scholarships? Oh God, we have a lot of scholarships. Rising Stars, we have them where if you're an honor student in high school, you get up to like $1,000 scholarship to come in. If you can maintain a 3.5 GPA for your first semester that you're there and you are inducted into the Phi Theta Kappa Honor Society, at that point you have about $60 million worth of scholarships available to you. These are people that want to pay you to not only finish school, but to get to your next degree, because the medical field, even though everybody wants to work in the medical field, it takes a very specific someone to work in the field. So not everybody makes it through. So do we have scholarships? We have a ton of scholarships. We have every type of scholarship that you can imagine. So you just have to come in, meet with an admissions rep, and they have to just evaluate your transcripts, your grades, things like that, and see what scholarship or ships do you qualify for.
And that includes the ACE diploma?
Mhm. Absolutely. Next question.
Do you have multiple locations for Kaiser?
We do. So, okay, ready? I should know these. I oversaw them all. Miami, Fort Lauderdale, my campus, West Palm, Port St. Lucie, Melbourne, Orlando, Tampa, Melbourne, Orlando, Tampa, Sarasota, Tallahassee, Fort Myers, Fort Pierce, Naples, and we have 2 locations in Georgia, 2 locations in China, 1 location in Nicaragua, and 1 in Puerto Rico. So I'd say we got a few, just a couple, just a couple. Next question.
What's the difference between being a PA and an
Okay, so I have 2 right now in physician's assistant school, 1 at University of Tampa and 1 at Nova Southeastern. So basically it's more of a step up for being an MA. So MAs, there are 3 things an MA can't do that a PA can do. So, and the reason they can't do it is because they can't obtain this one specific license. So you can get your basic life support license, which is your CPR license. As an MA though, you can't get what's called an advanced cardiac life support license, your ACLS. Why? You can't push a drug, okay? So if you can't push a drug, you can't give a narcotic and you can't push a drug, okay? So you can't give a narcotic and you can't push a drug. So as a PA, you can get your ACLS license, you can push drugs, you can give narcotics. The difference between an MA and a PA, even an MA and a DNP, doctor in nurse practice, or a physician, we can't diagnose and treat, okay? PAs can diagnose, they can treat, and they can prescribe. Now, what's nice about going from MA to PA, so my 2 students that are in it right now, have 4 general education courses that they need, chemistry, and Chem 1 and 2, and Chem 1, Chem 2, physics, and 1 other course, I can't remember, and then they go into the PA program. That's only a semester of courses that you need, and then you can go into the PA program. Now, physician's assistant is awesome. You can work alongside a physician, you can be your own physician. You can treat, diagnose, you can do just clinical, which means you're just strictly in a clinic. You can do clinic with a specialty. So let's say you wanted to be an ortho PA. You like to snap, crackle, and pop bones, right? So you see your patient in the office, you schedule them for a procedure, you could do a total replacement. So you're that person that's with them the entire time. Whereas in MA, we can't diagnose and treat, but we can carry out the treatment plan. Next question. 1 more.
What is the biggest highlight of your career, would you say?
Ask me that in 5 years, we're still getting there. 1 more question. Go ahead.
What would you have done differently in your career if you could?
I'd go back and tell my younger self, buckle down and study more. No, what would I have done differently? Honestly, I wouldn't have done anything differently. I would not have done a single thing. I needed to go very unconventional routes first to really truly understand things. So for example, I appreciated my master's degree from Miami and my doctorate from Grand Canyon University more because I had to pay for them. I had to sacrifice for them. So would I have enjoyed a full scholarship like I had for my bachelor's degree? Absolutely, I came out debt free. But I wouldn't have done anything differently. But I probably, I'll be honest, high school was very tough for me. I was more of a jock than I was a student. I only cared about swimming, I only cared about music, I did not care about school. C equals continue, so I made a C to continue. I probably would have changed my high school days. I would have gone back and actually studied, participated, and done better now that I see what is afforded to you guys coming out of high school. More scholarships, more opportunities, and more advancement. So I probably would have done that. I didn't know until I started teaching as an adjunct at Indian River State College. I thought it was always weird that I'd be going to teach and here'd be all these high school kids getting off this bus and I'm like, did they not understand they're on a college campus? This isn't high school. I had no idea that while they were becoming a senior in high school, they were getting their 2-year associate's degree in a specialty. So if I had known that, when I graduated as a senior in high school, I would have graduated with a full college degree right off the bat and been done. And been like, wow, this is great. So I probably would have looked into things a little differently, buckled down, actually studied, and appreciated the opportunities that were given to me.
All right, so everyone, let's give Stephanie Welch a huge round of applause. Wow, okay, I definitely feel like I learned something. Raise your hand if you learned something here today. Oh, that's amazing, there's not a hand that's down. All right, thank you so much, Kaiser University and Florida Atlantic University, again, for sponsoring this Career Speaker Series event. I hope that all of you have a better understanding of how to get to where you want to get to, and just understanding what it really takes to go into the MA field, the RN field, and so many more. So thank you again, and thank you, Park Vista and Ms. Finkel for hosting us today. Thank you, you guys, for a wonderful audience today.
You want to take a couple pictures?
Oh, yes. Please stay for a couple of pictures.
They're staying anyway.
Oh, you're staying anyway. Okay, perfect. So I'm going to let Ms. Finkel kind of gather everyone and tell us how we're going to take the pictures.